Hi, I'm Dr. Floyd Godfrey, and I'm excited to be here with you today. This is a topic that I really enjoy speaking about and working with youth, and specifically about a therapeutic approach for adolescents who have been harmed by pornography exposure. Just a little bit about myself so that you know who I am. I've been in the field of social services for almost 3 decades, and during that time, a licensed professional counselor for the past 22 years. I'm also a certified sex addiction therapist and supervisor to help counselors learn those topics. I received my PhD from the International Institute of Clinical Sexology, and I am also a certified clinical sexologist. I am the co-founder of a program called SABRE, which is the Sexual Addiction and Betrayal Recovery Program, and also the co-founder of the Band of Brothers program, which is a program for boys who have sexually compulsive behavior, either with pornography or other sexual behaviors. So that's the background that I come from. I've worked with hundreds of youth and adults who have sexual issues, and the topic of pornography is a common one nowadays, and everyone is talking about in the research and the ongoing research around that. The topic for today's presentation specifically is about harm that's caused by children and adolescents who have exposed to pornography. And so I think it's appropriate and important at the beginning to talk about what we mean by harm. Some youth and adolescents clearly are in a stage already of being curious about sexuality, about puberty and those kinds of things, and maybe exploring in naturally normal, curious kinds of ways. So what do we mean by harm? Well, when children and adolescents are prematurely introduced to sexuality before they're developmentally ready to handle some of that, it can cause confusion for them. Potential harms include miseducation, misinformation. Pornography teaches all kinds of incorrect things about human sexuality. In some cases, it can be so shocking and confusing that it traumatizes the children directly. I've also seen situations where the exposure can actually exacerbate or reinforce previous trauma, wounds, or deficits. So for example, we may have a child or an adolescent who seeks out specific kinds of pornography that might actually be mirroring some of the things that happen to them. So a child who's been abused and starts seeking out pornography in ways that is very similar to how they were abused. Along those same lines, I've also seen youth who potentially become addicted to some of the pornography as a way of coping with emotions, with difficulties, with stress, with previous trauma that they may have had going on. I've worked with youth who also have a lot of shame as a result of the exposure. It's so contradictory to what they had been experiencing previously, and maybe even to some of their upbringing or moral beliefs or standards of what the family has taught, that there's a lot of shame and they start to feel bad about themselves and who they are. I've also seen how pornography can increase risky behavior, experimentation with youth. Sometimes they are looking at pornography and they have images in their mind. Kids will tell me that they saw things that they would not have imagined previously, and then the exposure introduces them to a whole new arena of thoughts and curiosity that wasn't there before. And clearly it also exposes them to possible exploitation by abusers, offenders, people who are actively seeking victims, pedophiles who are looking for victims. So there's all kinds of potential harm, and how we're approaching the youth and adolescents would depend on what we're seeing, what are they presenting in our clinical work. So as a clinician, depending on what the presenting issues are related to the exposure to the pornography, there's going to be several items you're going to want to consider for achieving successful therapeutic outcomes. The first would be to consider the developmental needs of the child. And that's going to be obvious. An elementary school age child is going to have very different developmental needs than an adolescent who's in high school. Also, I think choosing an effective counselor, I think some counselors are more efficient at working with youth, with adolescents, so that would be important. Also understanding potential harm, as we just talked about, and what those possible things could be that might be harming the child specifically. I think for effective outcomes, you also want to develop some kind of systemic approach. I think having a child or an adolescent come in and just talk to you every week is not going to be as effective as having a system for working with them. I also think a high level of collaboration, general collaborative approach with parents, with counselors, with mentors is going to be critical. Rolling all of those items into one will help achieve a more successful outcome. Another consideration, I think, for successful outcomes would be making sure that you avoid labels. Children and adolescents are already in a stage of identity development. So we may have some of our own bias as clinicians, or the parents or mentors may have some bias, and there may be a tendency to want to label the youth and give them their identity rather than helping them in the process of self-discovery about that. So trying to avoid labels and help them do healing and recovery work around the exposure and the presenting issues would be really important. So we talked about what developmental needs a child would have, and elementary school issues would be different than issues and developmental needs of adolescents. So let's talk a little bit about what changes between elementary school, junior high, and high school, and some of the physical and psychological changes that occur. It's important just as a review. The first most obvious change that occurs are within the body. You have sexual growth going on, primary and secondary sexual characteristics that emerge. An adolescent will also have an increased capacity for compassion and emotional intelligence. They didn't have that before to the same extent. There would be an increased interest in bonding, in a sense of belonging with peers, both sexual and non-sexual. They often feel very intrinsically drawn towards their peers in ways they hadn't before. They'll also have an increased curiosity and need for healthy sex education. They need to understand, they want to understand what's going on around them, what's happening to their body, what's happening to their mind, and the growing curiosities that are happening. They also have a strong desire for independence, and this is one that often throws parents off, even some counselors. They want to start thinking on their own. They want to have their own opinions. They want to be independent, and so rolling with that will be important. Also, they have the ability to grasp more abstract thinking, moral constructs. They can wrap their brain around that in ways they couldn't before. They have a desire, as I said previously, to develop their own opinions and to express those. Their self-esteem and confidence will be growing, at least developing, and so having experiences that help them to reinforce their sense of confidence will be critical. And then also their exploration of spirituality, their understanding of it, their relationship with a higher power, any existential sort of experiences and thoughts will be new to them, but also exhilarating and something that they haven't experienced before. So working on some of those differences, helping understand, a clinician understanding what those differences are, will make you more effective in your clinical approach. In terms of treatment planning, there are 8 pillars of our treatment planning that we think are very important based on research and best practices in working with adolescents, and specifically with problematic sexual behavior or compulsive sexual behavior. So if a youth has been harmed in a way that they start compulsively using pornography or acting out in ways that feel out of control for them, then some of these things would be very important in your treatment planning. The first, significantly, would be a support network. Youth want to be independent, and so sometimes they'll have a tendency to withdraw, and they won't want help. They don't want their parents involved. They sometimes don't even want a counselor involved. But your ability to confront them on that, help them understand their need for a support network, both friends, but also mentors and adults who are safe in their life, that will be critical. Shame reduction is the second treatment planning pillar that we always talk about. Usually there's some sense of shame that develops as a result of some of these problems, and they start to question themselves, their identity, who they are. They feel bad about themselves. That has to be addressed. Recovery education, and so some basic information about what's healthy, what's unhealthy, what's normal, what's not normal, or abnormal, we would say, will be important, and just understanding the process of growth and healing in their lives. Social skills development will be paramount. Many youth who fall prey to ongoing problems with sexual behavior or problematic sexual behavior will often have disruption or difficulties in their social skills, connecting with same-sex peers, opposite-sex peers, and friends generally. Sobriety skills, if that applies, some of them may be feeling as though they can't stop some of what they started doing. So helping them understand tools, learning tools, what they can do to stop and get sober, so to speak, will be important. Also helping them develop self-esteem, confidence in who they are naturally, in their genetic makeup, in the things that they're good at, their strengths, that will be important. Strengthening family systems. Sometimes youth don't have a very strong family system, and that needs to be encouraged, developed, strengthened, or some type of system that will help support them. And then also emotional awareness. Youth often don't know what they're feeling. Children less so. There's a lot of turbulence throughout adolescence, and the confusion of trauma or the pornography can create more confusion around emotions. So emotional awareness, understanding themselves and what they're feeling will be the 8th pillar of what we would do. And everything around these 8 items and planning the treatment and work with them gives a well-rounded approach to the topic. So if those are important aspects of effective treatment planning, let's turn our attention a little bit to what makes an effective therapist effective. And I've worked with a number of therapists over the past 20 years and had the pleasure of rubbing shoulders with many who are very, very good with kids and youth. And there are 7 points that really stand out to me as making therapists especially effective with youth. The first is that they're really capable of light banter. So they can joke around with the kids a little bit, but they're still life experienced and mature enough to hold boundaries with them and to be directive. And you have to remember, as an effective therapist, the kid is walking into your office and sitting down with all kinds of transference that radiates out toward you. And it could be their need for a mentor, it could be the experiences they've had with other adults, and they're sort of energized around all of that. And so your ability to roll with that and set boundaries, but still interact with them would be important. The second one is to understand that there is a dual dynamic there, because they do see you as a mentor. And so again, rolling with that, setting boundaries, being able to step into that when necessary and step out of that. I also think effective therapists are confident and they're comfortable speaking to parents. They're comfortable teaching recovery concepts. They're comfortable challenging the parents as well as the youth. And many times the parents need some support. They need to be challenged. They need to be setting goals themselves, especially if you're collaborating. I think an effective therapist is capable of holding the privacy of the adolescent or the kid without falling under pressure from parents or clergy or mentors or others while teaching him about authenticity. So it's important to be open, to be transparent. That's a part of the healing process, part of the recovery process. At the same time, you can't be going back to the parents, back to the clergy, constantly telling them everything that the youth is talking about. Parents do need direction, they do need to know what's going on, and they do have a right to know what's going on. But you have to also be capable of walking that balance so that the youth feels as though you're being confidential and private for him or for her. Another point that I think is important, an effective therapist must be capable of explaining prior to and possibly disappointing the kid, the adolescent, if there's a need for disclosure for the safety of the teen and others, if that presents itself. So if the youth describes some situation that might be unsafe, an effective therapist is comfortable challenging the youth, explaining that he or she has to report that, and then moving from there. An effective therapist must be capable of receiving feedback for growth and improvement. The best therapists are asking other therapists and clients for feedback on how things are going. And you can change, you can grow. As a clinician, you should be improving and always setting goals for yourself. And finally, I think an effective therapist really needs to know recovery concepts adequately, to teach off the cuff, to be able to roll with the adolescent when they have questions about different things. And sometimes that means the therapist has been teaching the concepts or has read the concepts or has experienced in their own personal life some of these concepts, so they know how to teach and help the kid and the parents to know what to do. So in some situation, group therapy may be really important for you as a clinician to develop some group program that will help some of these youth. They are often extremely effective, meaning groups are extremely effective to help the youth to come into aspects of healing and recovery that they maybe can't do just you and sitting in your office together. So sitting with other youth who have also experienced some difficulty, some trauma, some harm, may be extremely beneficial. So some of the aspects of group therapy that will make all the work more effective, the first is I would try not to incorporate sex offender youth into your programming. It's a different set of criteria, and in terms of what the youth need and what is helpful will be different. They need to learn something different. If they've been involved with molestation of a child or they've crossed the line into illegal kinds of activities, that's a separate kind of programming. So I wouldn't try and incorporate those kids into a group. Give them their own separate type of group experience. The second thing with group therapy is I would communicate and engage with the parents, the mentors, the religious leaders, whatever the support network looks like. You want to be careful not to reveal private matters to those folks, but you want to collaborate with them so they know what you're teaching, you know the kinds of conversations they can follow up with the youth. You want to keep it all going, and so collaborating with parents is important. I think having an agenda-driven group, so if you just bring the youth in, bring the kids in, and all you do is just talk about what's been going on, probably will not be as effective as you having an agenda about what you're going to teach, about concepts you're going to review, about things you know that some of the kids need to talk about, and just get to it. I think it's important to make sure that your group therapy program, whatever it looks like, that it's cool. It's got to be fun for the kids. If they don't like it, if they don't think it's cool and fun, you probably will be less effective. I think collaboration in group therapy with other therapists will be really important for an effective group. If I have a group of 12 teens coming into my program and several other therapists are involved with the teens doing individual work and I'm doing the group work, if I know ahead of time because I've collaborated, I have an ROI with some of those other therapists to be able to talk about the youth, and so I know what the issues are, then we can really address some of those issues directly in group and both in educational worksheets and concepts as well as experiential working through those issues individually. Providing structure, solid structure, using written materials, I also think is important. Kids don't like doing homework, I understand that, but giving them things to learn and do outside of the group so when they come back, you can get more going and you have more traction will be very helpful. We also have created in our program, our Band of Brothers program, we have a system for the youth to track their progress. Kids need to see that something is moving. They need to see that they're making progress. And whether that's a simple chart and they mark off the chart every week they come, or some kind of stickers, or depending on the age of the youth, however you want to manufacture that, it helps them to see from the outside that they're doing something. Also, requiring some form of individual and family therapy will really help group therapy be more productive. So if I'm seeing a youth individually, I do some counseling things individually, and then I send them to group with some assignments to accomplish in group, and we go back and forth, we just get more done. There's more traction, more movement going on. And also finally, with effective groups, sometimes you may want to do external motivators. And not that you're bribing the kids, but if they have some kind of a reward they're looking forward to. So for example, if they all accomplish their goal during the week, and then the follow-up week you order pizza, and they all have pizza or they have some treats or something. It's just something fun to look forward to so they can be accomplishing their goals and sort of externally motivating them. Youth and kids don't have the same kinds of intrinsic motivators that adults would have. Where adults with some sexual problems or trauma, the risks and the consequences may be a lot heftier in terms of losing their family or their jobs or not being able to function with their employment. That's a lot more egregious than it would be if you're a kid and you're doing it because you got in trouble and you don't know why you're supposed to stop, but logically it's understandable. So giving them some external motivators can be really helpful. So let's turn our attention now to parents and mentors and clergy and other people that might be working with the youth in terms of a support network. There are things that always seem to come up that we would always be teaching these folks in terms of how to help. And a quick list of those things that I would share with you. One of the first that we would always talk to parents about is don't get defensive. And I know that sometimes adolescents and kids have a way of pushing your buttons and sort of cause you to get upset. But if you'll prevent yourself from getting defensive, you'll be a better support. Learn their language. Parents have got to learn how to talk to their kids. They're using jargon and slang that sometimes parents don't even know what they're talking about, and to be able to use that and get on their level would be important. Remember the kids' friends. You want to be a parent that your kids talk to? Who are their friends? Bring up their friends. Talk about their friends. What does their best friend like to do? It goes a long way. Be capable of discussing their music. Believe it or not, if you can come up with some of the favorite bands the kid likes, even if you don't like the music, your ability to remember who the bands are and who they like will be really important to keep a conversation going. Trying out their hobbies. That's another suggestion. If you can find something they like to do, even if you don't like doing it together with them, trying it out, it shows a lot. It shows that you're open-minded, and you want your kid to feel like they're going to be open-minded to what you have to say, so be open-minded to some of their hobbies. Along those lines, ask them to teach you something. And maybe it is around that hobby, maybe it's something else. Teach you something they learned at school, or maybe you want to teach them about stamp collecting or motorcycle riding or whatever they're interested in. Ask them to teach you, and you just listen. Again, along those same lines, ask the youth about their opinion about something, being prepared as a mentor, as a parent, not to respond with what your opinion is. Just let them tell you what they think, because they're developing their opinions. It's the stage of their development. And take time to play with them. It's another critical piece. Just to set aside time, nothing serious, just play, just to have a good time, just horse around together. And then ask them out of a place of curiosity questions about their reality. So for example, hey, son, tell me what it's like at school nowadays. Help me understand, what are they serving in the cafeteria? What is that like? What is it like having the internet constantly everywhere? Just be curious, and don't offer your opinion, just be curious. It'll go a long way to get on the same page, and if you find that you have parents, clergy, you have mentors who are on your same page, they can talk to the youth, they can support them better by doing some of these things, your job as a clinician gets much easier. And lastly, I would say one of the things that we always find ourselves teaching parents is to discuss morals and motivation. Sometimes parents really need to check themselves. Why are they concerned about their teenager or their youth, however old they are? Sometimes parents have a limited motivation that's driven by a moral compass. And they're not really thinking about emotional hazards or things that are unhealthy versus healthy. They're just thinking about what their own opinion is of right and wrong, and it's very black and white. So you have to consider, if that's all you have to tell the youth, that that's wrong, and you haven't really considered why. Why is that wrong? What is it about that behavior that makes it unhealthy? Then they're going to be very limited in how much the youth wants to talk to them or how much the youth would respect what they have to say. Parents really need to understand what's underneath that moral value of right and wrong and why. So healthy versus unhealthy. So over the years, as we have talked to youth about what they need to be able to feel safe with their mentors, with parents, we came up with a list. And some of the things I've heard over the years, if we review these quickly, that kids have said. They have told us that they need someone to listen without lecturing or criticizing. They often say that they need someone who can hear embarrassing things without flipping out. They will say that they want safe adults to know that sometimes it freaks them out to tell anyone about some of these things because they're used to keeping it a secret, and that it's a really big deal that they're even sharing it all. Sometimes youth have said that they want safe adults to promise that they won't tell their personal stuff with others, that they won't gossip, they won't tell other family members, other adults, that they'll keep it private. Youth have often said that they want to know that he or she, mom or dad, whoever the adult is, that they're not disappointed and that they'll support them even though they've shared. Youth often want to know that he or she cares about them and that they'll check up on them, take an interest in them, not just that the youth is going to tell their stuff and then they never hear from the adult again. They want to know that they'll promise that they won't give up on them, even if the youth keeps struggling, keeps messing up, or keeps giving up on themselves. They need encouragement. We've heard youth say that they want to be encouraged, to receive compassion, because sometimes they feel discouraged and they don't know how to express that. We've often heard youth say that they want their safe adult mentors to be patient, to be understanding. That sometimes they want to make their own decisions, have their own opinions, but they'll still be loved anyway. Youth will often say that they need to ask, that they want the parents, they want the adult to ask questions without avoiding embarrassing ones. And this can be a problem because many adults are too embarrassed to talk about sexual things, to talk about pornography, and the kids want you to talk about it. So you have to get over your own embarrassment. Sometimes kids have said that they want their safe adult to learn about some of the problems that they're going through so that they know how to talk with them when the topic comes up. And so those are factors that many youth have said help them feel safe, that they can open up. And we would often talk to parents, support network about those things so they can work on some of that. This is where parents, adult caregivers need to work on some things to help the youth feel as safe as possible. Second to that, once you develop some safety skills, parents and support network need to teach attunement. This is different than being empathetic. Attunement is someone's ability to engage another person, to stay present with them, and it involves some basic communication skills that keep you attuned to one another. The first one that's real easy is to listen without responding. Sometimes you just need the youth to talk. Let the adolescent talk to you. Don't talk, don't cut in, don't prepare what you're going to say, just listen. Also to be able to use I statements. Talk about what you've experienced from your own life rather than speaking in generalities or trying to make assumptions about the youth. Just speak from yourself. Be capable of reflecting back before responding. So sometimes that's really just about repeating back what you heard. So if the youth, maybe she tells you something and you just want to make sure you get it, so you reflect back. So what you're telling me is, and then repeat it back. Make sure you have it before you respond. And then when you do respond, I would encourage you to ask permission. Would it be okay if I shared some thoughts with you? And sometimes they won't want to hear your thoughts, and it's okay to just hold back. Wait for them to ask. And other times, if there's safety, clearly you need to say something. You need to step in and tell them. But other times, they're developing opinions and they're just wanting you to hear them. So asking permission is important in terms of teaching boundaries. So also with attunement, parents have got to know, support adults have got to know, you have to watch your tone. Sometimes parents and adults are not attuning to them, they're simply preparing their speech or what they're going to say next. Sometimes parents aren't really attuning, rather they're thinking about solutions to the problem and how to fix it for the adolescent. Sometimes parents aren't attuning, rather they're moralizing the issue and they're coming up with reasons why it's wrong or what is right and wrong instead of listening. And so clear attunement requires listening, staying present without going to those kinds of places. And I think to stay attuned when youth are speaking, whether you're a clinician or an adult support person, is to keep your own emotions in check. You may have your own anger come up, you may have your own sadness come up, your own anxiety, your own fears, especially if you have your own history around sexual problems, around pornography, around abuse, things that may have occurred, and how do you bracket some of your own feelings so that you as an adult can get support? As a clinician, you may have to work with some of those adults so they know how to bracket, they can learn how to do that, or work through some of their own stuff so they can attune and be more present to the youth that they're trying to support. And sometimes that also involves, I mentioned fear and anxiety, but parents, adults, they can sometimes get worked up into their own fear cycle. And so they get all worked up about the fears of what's going to happen or what has happened, or somebody's going to get pregnant or somebody's going to get an STD, and you get all riled up in your own mind. And if you get into that fear cycle, good parenting is never going to happen. You have to get control over that fear cycle, take a deep breath. Adults have got to recognize the fear, sometimes reach out to a spouse or a support person of their own, a family member, a friend they can talk to just get back into a place of logical thinking. And when youth come to you and they start to open up because they feel safe, they're going to be increasingly honest, increasingly transparent, increasingly authentic, which sometimes means they're going to say something you're not prepared for. And so you have to be capable of responding and pausing, taking a deep breath. And it's okay to say that you don't know. I don't know. Let me think about that. Let me get back to you. And then as a support person, go seek support. Go to your counselor. Go to your spouse. Go to a friend. Talk through some of it so you can think clearly before you just jump out and give the kid some advice. The support network for the adolescent, for the kid, is going to be important, and teaching them how to be a better support, how to be a strength, might require them working through some of their own personal issues, family issues. And so as a clinician, your treatment will be more effective with the youth when you're indirectly working with the family system. And that's just important. When you have a family system or a support system that's stronger, a little bit more helpful when that's in place, then it's easier to start to consider what is the teen's internal response. And it doesn't matter whether they have a history of abuse, or it was simple exposure to pornography, or they started acting out compulsively with pornography, or some other internalized, exacerbating event due to the pornography. A child is going to have an internalized response, which could include guilt. They may be filled with guilt. They may be filled with shame. And remember, that's very different than guilt. Guilt is feeling bad about something that they've done. Shame is going to be something that they feel bad about who they are because of what they've done. It's more of an internalized identity piece. They may be hiding to escape their own fear. There may be a lot of confusion about sexuality, about the emotions they have that they don't understand. There may be a sense of excitement and arousal that they don't understand. There may be a sense of panic or fear. They may be feeling very lonely and alone around everything that's happened and what they're going through. There may be a lot of worry. So in a nutshell, the adolescent, the child may be an emotional blender, and there's so much going on that if you consider that response and pick it apart one piece at a time, you're going to be much more successful in the treatment. Remember, I mentioned this briefly, but shame is more toxic. We're talking about the toxic version of shame that tells someone that they are bad, that they are a mistake, that something's wrong with them, instead of making a mistake, or that they are, what they did was bad or wrong. And so you have to differentiate that, educate them so that they're not filled with shame, and rather they can just deal with the guilt. And then remembering that shame breeds isolation. Toxic shame destroys self-worth, identity. It creates a sense of isolation that can be literal or emotional. So a kid could be in a party, room full of people, and still feel completely isolated and alone emotionally. Hiding, secrecy are forms of isolation, and ultimately isolation is the lifeblood of compulsions and addictions. And so coming out of that isolation into a support network is going to be critical for effective therapy. Remember that making programming fun, whether it's in your office for individual therapy or in group programming, is going to be essential so that the youth want to come back. They want to work on these issues. Developing your support network, educational tools, all of these things rolled together will be important for effective treatment of youth and adolescents who have been harmed by exposure to pornography. In conclusion, I just share with you, we've worked with hundreds of youth, kids and adults who've struggled with what they feel they've been harmed by pornography and other sexual behaviors. And I remember working with a 15-year-old who had come into my office. He had already been abused as a young child, and when he discovered pornography and started to search for pornography that mimicked the same thing that happened to him, it almost opened a new door. And I remember him telling me that the boundaries were softened and he found himself doing things that he didn't want to do, even compulsively crossing lines and nearly getting himself arrested, and telling me, this is not who I am, this is not who I want to be. And in his own words, feeling as though pornography had catapulted him into all kinds of experimentation and risky behavior and things he would not have done otherwise. And finding healing in his life and getting himself on track and maintaining boundaries and getting sober from the compulsive behaviors and was very gratifying as a clinician. And there are thousands of youth across the world that need your help as a clinician. And I have no doubt if we are effective therapists and are following a systemic process that we can help youth and adolescents who are struggling with the exposure to pornography and compulsive sexual problems. I appreciate talking to all of you today and being here, and hope that everyone finds success. This is a very important topic nowadays, and pornography is rampant across the globe, and it's impacting kids and youth in a diverse kind of way, and how it affects different youth in different cultures will be important to work with them wherever they are and whatever they're going through.